healthcare professional that needs to improve your medical English so that you can be more confident when using medical terminology, well, you've come to the right place. In today's video, you're going to be practicing medical terminology in the context of COVID. In today's lesson, there will be a discussion between doctors and a clinical case of COVID. And watch the video all the way to the end because I give a few more surprise tips on how to improve your medical vocabulary. If you're new here, hello, my name is Dr. HS. I have a PhD in medicine. I'm an Australian scientist. I'm a certified translator, and I have this YouTube channel to help healthcare professionals improve their medical English so they can speak more confidently, more clearly, and more fluently in medical terminology. So if that's something that interests you, subscribe to my channel so I can make more videos for you. Today's lesson will be split into 4 sections: keywords, scenario, imitation, and surprise tips. If you already know how the lesson goes, go straight to the time up here so you can start learning the keywords. If this is your first time here, I'll just give a quick overview on what's going to happen. In the first section, it's the keywords. I'll be teaching you new words, and you will be repeating them out loud after me. Repeat them as many times as you need to until they flow naturally. In the second section, it's the scenario. Just observe, just watch it. In the third section, it's the imitation. The scenario will play again, and after each sentence, there will be a pause. You will be repeating what was just said out loud. So you will be imitating the character. In the fourth section, there'll be some surprise tips, and I won't tell you what it is because you're going to watch all the way to the end to find out. So let's get started. If you need to add subtitles, you can do this by clicking on CC and then choose the language in settings.
You have to say it out loud.
Say it out loud.
The keywords of today are emergency department, emergency department,
There was a non-emergency emergency. There was a non-emergency emergency.
That's the emergency? That's the emergency?
ICU, ICU. It's the intensive care unit. ICU.
Wilson, call ICU. Wilson, call ICU.
To the ICU, dear. He'll show you up. To the ICU, dear. He'll show you up.
Only family, doctors, and patients in the ICU.
Fever, fever.
Still have a fever? You sure that thing's working right?
I think I might have a fever and/or the chills.
Cough, cough, cough. Myalgia, myalgia, myalgia.
And their spasms and their cramps and their myalgia and their neuralgia.
Myalgia, alopecia, a rash.
Sore throat, sore throat, sore throat.
Marie Antoinette with a sore throat. Napoleon.
Are you getting a sore throat?
I have a cold. You know, the runny nose, and the sore throat, all that.
If the lesson is too difficult or too fast, you can change the speed of the video. You can do this by clicking on the settings and then choose how fast you want the video to go.
Hi team. Today Dr. Anderson will be presenting a clinical case to the group. Please go ahead, Dr. Anderson.
Patient 1. 45-year-old male, presented to emergency department with fever, cough, shortness of breath. Other symptoms included myalgia, headache, sore throat, diarrhea, nausea and vomiting. The patient presented with a mild disease at admission and a secondary worsening that resulted in their admission to an ICU. The morphological pattern of the lung CT scan showed regions of ground glass opacification and consolidation, with variably comprised foci of edema, organizing pneumonia and diffuse alveolar damage.
What was the patient's medical history?
The patient had a history of hypertension and diabetes.
How about the lab results?
White blood cell count was below the normal range at 5100, while he presented high neutrophilia at 3800.
How about the results for viral swabs?
Positive for SARS-CoV-2.
Okay, so it is clear that this patient has SARS-CoV-2. Hi team. Today Dr. Anderson will be presenting a clinical case to the group. Please go ahead, Dr. Anderson.
Patient 1. 45-year-old male, presented to emergency department with fever, cough, shortness of breath. Other symptoms included myalgia, headache, sore throat, diarrhea, nausea and vomiting. The patient presented with a mild disease at admission and a secondary worsening that resulted in their admission to an ICU. The morphological pattern of the lung CT scan showed regions of ground glass opacification and consolidation, with variably comprised foci of edema, organizing pneumonia and diffuse alveolar damage.
What was the patient's medical history?
The patient had a history of hypertension and diabetes.
How about the lab results?
White blood cell count was below the normal range at 5100, while he presented high neutrophilia at 3800.
How about the results for viral swabs?
Positive for SARS-CoV-2.
Okay, so it is clear that this patient has SARS-CoV-2.
So in today's lesson, you learned how to present a clinical case to other doctors of COVID. And you also learned how broad the symptoms can be. So do you know any inflammatory markers that can be increased during COVID? How about cytokines like IL-2, IL-6, TNF-alpha? Are they increased during COVID? Did you see that you just learnt a few new words just by talking about the cytokine markers with me? I hope you liked the lesson today. Subscribe to my channel, like the video. See you soon.